The term prostate cancer is a very general term that encompasses disease that is not that significant and also very significant disease. And the question that urologists have always been faced with is who has the bad disease, who needs to be treated, and who doesn't have bad disease and we can follow that person. Enter MRI. Prostate MRI is still relatively new. It is a very challenging type of MRI. And the issue is really that the prostate is a very small part of the body and it takes a lot of work to what's called optimize the protocol so that the image quality is sufficient. It's very easy to do a prostate MRI, but it's very challenging to do one that meets the standards set by the PIRADS committee, which are based on research. One of the studies that we did here at Columbia was looking at all the MRIs that we had decided did not have any prostate cancer on them. We found that in something like 90% of patients who had a negative prostate MRI, there was no cancer on biopsy, which is very comforting both to us and to the urologist because now they know what it actually means when our group tells them the MRI is negative. We now appreciate that there's actually a role for imaging to not just find cancer, but also to rule out cancer. I think that's what's very interesting about research. You're able to ask questions that interest you, that have clinical implications, and try to answer them, and that can actually have an impact. That can actually change the way you practice medicine.